3, and I do have appointments at 4, so I think we'll get started. So I want to welcome all of you to our workshop this afternoon on rotator cuff and shoulder pain. And this is where we help people to get back to normal, or we educate people on how physical therapy can help you get back to normal without the need for unnecessary medications, injections, or surgery. So welcome once again, everybody. And I'm Dr. Raji Doraiswamy, and I'm a doctor of physical therapy and the founder of Opt Physical Therapy and Wellness, where you all are sitting. And I've been a physical therapist for 40 years and started Opt Physical Therapy about 30, coming up on 30, starting our 35th year. And in this time, I have had the opportunity and the privilege of helping thousands and thousands of people with shoulder pain, neck pain, and back pain, and a lot of other conditions. And I myself went through a rotator cuff tear. I have a rotator cuff tear, and I was able to resolve it with just physical therapy. So having gone through that, personal experience, and with over the years helping so many people, I just found that, people are always amazed at the end of their physical therapy that, how much it helped. And they're always surprised that, I never knew that physical therapy could help this. I thought I would have to, need surgery. And so we decided a couple of years ago that, why don't we host these workshops where we can educate people and let them know that, physical therapy is a great avenue to get back to normal without the need for unnecessary medications, injections, and surgery. So having said that, Shannon, who was supposed to co-present with me, but unfortunately our schedule got a little crazy, and so she's not able to be here, but you will get a chance to meet her. She's our physical therapist assistant. She's one of them. And she was going to co-present with me, but it's going to be just me as of right now. So, having said that, that was my personal journey, and so that's why we started hosting these workshops. And we found that many people have come in and they've signed up for physical therapy and they've really benefited and not needed surgery, and they've been able to get back to normal. Okay. I had a chance to meet some of you who came a little bit earlier, but I didn't get a chance to meet everybody. So if you could just quickly, give me your first name and just a quick brief on, what's going on with your shoulder.
My name is Richard, and my wife Teresa. She doesn't have any issues. I'm the one with the issues.
Okay.
So she's just keeping me company.
Okay.
All right. And I just got I saw one doctor, and he says it's like little arthritis and tendonitis, and it's not severe pain. I just don't want it to get any worse than it is.
Right, okay. That's very wise of you.
I have full range of motion.
Okay. Okay. And you, sir?
John,
Hello.
I'm talking loud because I can't hear everybody with this mask on, and I'm half deaf and blind anyway. I hurt myself on a construction job. I lifted something way too heavy. I couldn't drop it, so I pushed and I tore 3 major tears in this thing 10 years ago. I was a fisherman, and I used to fish bass tournaments, and when I cast for 8 hours, I'd have pain here, and on my wrist. And I was saying, why am I having pain doing something I did for 30 years, and now all of a sudden I have pain? Anyway, I finally had an MRI. He says that 1-day surgery. I can't guarantee you the range of motion you have now, but I can guarantee you no pain. I said, what if I don't have the surgery? He said, you'll have pain. I said, I'll live with pain. I'm not going to give up 6 months of my life in the summer, not fishing, not gardening. In the winter, I'm not going to give up shoveling snow and all that fun stuff that I love to do. And chopping firewood with the axe, cause I burn wood in my wood stove.
Okay.
Anyway, I have very weak, when your rotator cuffs surgery wasn't done and things heal in the wrong place, you don't have the leverage and the mechanical advantage that it was designed to have. So I have weakness now. When I used to do push-ups every night, every time before I took my shower, I do 50 push-ups. When I try to do that, this makes a lot of noise. I'm afraid I'm gonna blow something apart, so.
Okay.
I'm just here to see if I can have some strength back.
Okay, fair enough.
Sorry I talked so long.
No, it's okay. So, all of you are here with some sort of shoulder pain, right? Or pain in the arm. So let's dive right into the presentation and see what I can share with you, and probably help you at least get some idea what this is all about, right? What the pain could possibly be from. So first, we're gonna look at the anatomy, which is an overview of what the shoulder and the rotator cuff is all about, and what is underneath the skin. So the rotator cuff is a group of 4 muscles, and these muscles attach to the underside and the top of the shoulder blade, okay? And they come around and they attach to the arm bone. And they basically help you to be able to move your arm. Now, in addition to the rotator cuff, there are 4 other areas that work together in order to, for us to be able to move the arm. And those 4 areas are your neck, the collarbone, the shoulder blade, and the rib cage. So these all have to work in good harmony in order for us to be able to have full pain-free range of motion and full strength to be again able to cast or throw a baseball, whatever. So let me ask you folks, so is your pain reproducible? What does that mean? That means if you are just sitting and resting and you typically have no pain or minimal pain, but then you go to do something and you have pain, right? That means the pain is reproducible. So everyday activities like reaching overhead, like Tim you were talking about how just when you reach to put on your socks or shoes, you feel the pain. But otherwise you have no pain, correct? Or minimal to no pain. So that means the pain is reproducible. Lifting, carrying, like you said, that just
Repetitive.
Yes, and you have weakness when you try to do something. Reaching behind you, Joyce, right? You talked about how you are not able to reach behind you. So, sleeping, that was another thing, right? Who was talking about that? Was that you? Sleeping, okay. So, these are everyday activities that, we don't even think about anything when we do them, right? They're so spontaneous. But when you have pain, of course, they become difficult and they make you miserable. So when you have pain, typically there's 3 different ways that we as human beings deal with it, right? The first, most common thing that we do is that we kind of just ignore it. And when I say ignore, I don't mean like, just not think about it. Of course, that is one thing we do, but we tend to justify it, like, well, I'm getting old, yeah, I just turned 65, I am getting old, or I'm 80, of course I'm gonna have pain, and there is arthritis, and so there's pain, and so on. So we try to justify it that way, right? The next thing we do is that we try to alter it. And what that means is, either we take medication, sometimes, you go see the doctor and you get an injection. So you're basically trying to hide the pain, you're trying to mask it. Another very common thing that we do is we just avoid doing that particular movement. So, how many of you have done that, right? Well, it hurts to reach up with my right arm, so I'm not gonna use that right arm, I'm just gonna lift and reach with my left arm. How many of you have done that? See? hurts to reach behind me, so I'll just get a long handled bag, you know? Or I have trouble reaching to tie my shoes, so I'm gonna bring my foot up closer to me, so I don't have to reach with my arm. So you're basically, you know, altering and modifying the way you do things just to avoid the pain. And, you know, that's not really fixing the underlying problem, right? You're just masking it. Of course, the ideal way is to get to the root of the problem, right? It's like anything else. You want to fix the cause of the pain, not just be masking it by, you know, taking medications or getting an injection or avoiding using it. So, before we talk about, you know, how to deal and fix the cause of the pain, let's take a look at what are the, you know, most common causes of shoulder pain. So first, the problem could actually be in the neck, okay? And what that means is that, you know, the muscles of the neck and the shoulder are they're connected, you know, they're neighbors. So there's an overlap of the muscles. So if you have, you know, tightness in the neck, it could be overloading on the muscles that attach to the shoulder and causing you a pain in the shoulder. Another very common issue is, you know, we have, let me see if I have yeah. So, as you know, we have the spine, right? This is your vertebral column, and in between every two vertebrae, we have spinal nerves that come out and, you know, go down to the arm, and then from the lower back down to the legs. And those are the nerves that carry the sensations of pain, and they're the messengers, you know, the pathway for the brain to tell the muscles to work. So what happens now is that, think of it as a garden hose, right? If you're watering your garden and all of a sudden you find that the water pressure has gone down, and you look and you find that there's a kink in the hose, so that's interrupting the flow, right? So similarly with the neck, what could happen is that, you know, if those nerves are pinched somewhere, either by herniated disc or by you know, a muscle that's tight, you're gonna have pain that travels down the arm. And you're thinking it's my shoulder, but the problem is actually in the neck, okay? So that's, you know, one common problem where we talked about how the 4 areas that have to work together. If the neck is not working in synchrony with the, you know, with the shoulder and the arm, it's gonna give you pain. So this is shoulder impingement. Has anybody heard about this term, shoulder impingement? No. Okay. So what I'd like you folks to try is, you just raise your bad arm sideways and go up, and see if you experience pain as you go from here to here, and then the pain goes away. And then no pain, and then all of a sudden in the middle of the range you get pain, and then again there's no pain. Anybody with that? No pain, then you get pain, and then again the pain goes away. Right? So the pain is basically in that short range. You know, you have no pain for part of it, and then suddenly you feel pain, and then the pain goes away. So that's an impingement. And what that impingement means is, so the shoulder joint, right? It consists of the arm bone. Let me go back here to the slide. Okay. So this is the arm bone, and this is the shoulder blade, which has a ridge like that, okay? And then you have the collarbone. So this is looking at the front of the shoulder, okay? This is your arm bone, this is the collarbone, and then the shoulder blade is behind that. And that ridge comes and hooks like that around, and then the collarbone meets that ridge, okay? And this is called the acromion process. It's a big fancy word that you don't need to know. But what happens is that, see how this tendon is traveling underneath this? Now, because of bad posture, what happens is that we end up with our shoulders forward, which makes the space underneath this bone very small. And when you're moving the arm and that space is very small, it's going to impinge upon this tendon. And that's why you have pain only through a certain part of the movement, because the rest of the time there's no pressure on that tendon, but when you go to move your arm up, that space is too narrow and it's going to pinch on it. So that's what an impingement it is, and that's, you know, one very common problem with shoulder pain. Okay. The next very common cause of shoulder pain is tendonitis. I'm sure this is a common word, right? Everybody's heard of tendonitis. And what is tendonitis? So the word itis means inflammation. The tendon is part of the muscle. So the muscle usually has like a, you know, thick part like this part that's bulky and soft. That's the part of the muscle where it's all muscle fiber. And every muscle ends in a tendon, so it has to, you know, become small and firm for this to go and attach to the bone, and that's the tendon. So when it gets inflamed or irritated from either lifting something too heavy, I think that was you. Somebody lifted something very heavy at one point. That was you, okay. And what happens is that when you lift something very heavy, or you fall, or you have repetitive movement, so all of those can cause irritation and inflammation of that tendon, and that's going to give you pain. And of course, we have several muscles around the shoulder, so it could be tendonitis of any one or more, you know, one more of those muscles. And then finally, we come up on rotator cuff tear. Now this is showing the rotator cuff tear of just, you know, one of the four muscles that form the rotator cuff group, muscle group. And typically when there's a tear, it can happen either from, you know, just, you know, one single incident, or it could just be from, you know, overuse and wear and tear, and then it just spontaneously just ruptures. And typically what happens with that is, you know, when there is a tear, it's trauma to the body. So that can give you pain just from, you know, the trauma itself. So what can we do to fix that? That's what you've all been waiting for, right?
Yes.
But that tear doesn't need surgery?
So it depends on, you know, what your goal is, and whether it's a tear that can be fixed. Okay? So that's when an MRI will tell you more, but not every tear needs to be fixed.
Okay.
Like I said, I actually have a rotator cuff tear myself, which I sustained from a car accident. And I never had to have it fixed. It's just resolved with physical therapy, and I have no issues whatsoever. I have full range, I can reach everywhere. I garden, I lift, you know, I do everything. I do yoga, I can, you know, do push-ups, no problems whatsoever. And of course, you know, treated several people with rotator cuff tears that did not want to have surgery, or, you know, couldn't because age was against them or their medical condition was against them, and so on, and, you know, very successful. So what will happen is that, obviously you would have to have an assessment and evaluation to come in and, have your particular, shoulder evaluated by a doctor of physical therapy. And when we see you for the first time, we're gonna assess your overall issue and status. We're gonna ask you all about your symptoms. And that will include, what your lifestyle is, how you sleep, what do you do during the day, what do you experience throughout the day, and so on. And then we're gonna examine your shoulder and your neck, and take a look at what are your impairments, what's your strength status, what's the, status of your flexibility and your range of motion of the shoulder and your arm and so on, and your neck. And in addition, we're gonna check to see if you have any, muscle tightness, any trigger points. We're gonna take a very close look at your posture. Like I said, if your shoulders are forward, that's a big, cause of shoulder issues. Because when the whole mechanics of the shoulder and the, everything else that has to work with the shoulder is altered, you're not gonna be able to move your arm, in its full range of motion. So taking a look at all this helps us put the pieces of the puzzle together. And once we, have all those, pieces in place, that's when we'll be able to tell you, what can we do to help your condition. And again, going back to posture, as you can see, that's good posture. And this is very common, especially today, we call it text neck. We have so many nowadays teenagers coming in with neck and shoulder problems. Because with this virtual school there, everybody's like this with their devices. And this is how we are seeing everybody today. Very rounded, the shoulders, they're turned in. So when the shoulder is turned in, that arm is not able to glide properly within the shoulder joint, and you just lose your range, So this is, so posture plays a key role, and we take a close look at that. So once we have assessed all of that, it helps us to put all the pieces of the puzzle together, and then we can, create a treatment plan for you. So what does a typical treatment plan look like, right? So we would do modalities and hands-on techniques. Modalities are basically agents like ultrasound or laser, that help. They are an adjunct to help, relieve and reduce the inflammation and the irritation in a case like tendonitis or, anything else. If there is a muscle spasm or trigger points, it helps to reduce all of that so that it makes it easier, for us to be able to help you with your range of motion and, for your body to be able to tolerate and be able to build on exercises that's going to help you long term, okay? And then we're going to show you exercises that's going to help you to improve your flexibility and your mobility and be able to, get more range so you can reach further, reach your back, reach your, reach behind your head, reach forward, and so on. So those are exercises that will help you with that. And then of course we'll be doing strengthening and stability exercises that will help to build strength, right? Like John wants. Sleeping, if sleeping is a problem, we teach you different sleeping, positions that will help you sleep better so you can get a good night's rest. So, bottom line, you want to be proactive and seek treatment that's going to give you long-term benefit. Like I said, altering the pain is a very short-term thing. You could take medication you could take injections and they help short term, but it's not fixing the underlying problem, because beyond all that, beyond the pain, there is this dysfunction, which is, you know, the lack of full mobility, the lack of strength that's causing this. And unless you fix that, the pain will always end up coming back. So the pain basically is a manifestation of that underlying issue where, you know, there is lack of mobility, lack of strength, lack of flexibility in those muscles, you know, which gives support to the shoulder. And unless you fix that, you're not gonna be able to use your arm in a normal manner. So, you know, the earlier you seek treatment, you know, the better the outcome's gonna be. The longer you wait, the more complex the problem becomes, and it makes it harder. And you will have, you know, you lessen your chances of having a full recovery, the more you wait and the more you procrastinate. So what can you folks do next? You know, we have appointments available. There's no sense in, you know, waiting and procrastinating, because it's only gonna, the problem's only gonna perpetuate, become more complex, make it harder to fix it. And, you know, we do have appointments available, like I said. We're happy to help you. We are here to help you. We've helped thousands of folks, and you know, we're happy to help you too. So, but you have to take that first step, okay? So what I can do now is, if anybody wants to volunteer, we can go out to the clinic and I can take a look at the shoulder, and, you know, and just so you get a flavor of, you know, what the treatment and the evaluation is like. And, you know, I can answer some questions for you folks now.
The doctor's prescription needed?
Yeah, so let me just put this up. These are some frequently asked questions, and this is one of them. So you do not need to see a doctor before you see a physical therapist. However, certain insurances, you know, does require, like Medicare requires a plan of care to be signed by a physician. So what we do in that case is, you know, you come in, you get the evaluation, and then we collaborate with your physician, either your primary care or if you see an orthopedic doctor or so on. And we, you know, send them our evaluation, and, you know, once we're on the same page, they, you know, they take a look at that, and, you know, they sign off on it, then you're good. If it's not Medicare, you don't really need a doctor's prescription. You can just continue therapy. It's only with Medicare that you need that. Any other questions on that?
And if you still have a therapist, because I'm going somewhere.
Uh-huh.
I mean, that's what I learned is new for me. I didn't even know what was going on. So is it, and I have Medicare, do I switch?
You can, you know, absolutely. You could switch anytime you want. You know, the choice is yours. You know, where you want to go for therapy. So you always have that option.
It's sort of like going to a mechanic, right? Not all mechanics are the same.
Right.
Some people don't admit that they don't know, right? Whereas they've done this for 35, 40 years. So you want something like a shoulder, you want to go to somebody who's done it before, right? Very often there are people that don't have the experience, they won't tell you that. So it really depends where you're going, who you're seeing, etc.
I have a Medicare Advantage plan
Okay.
that doesn't require referrals from my PCP.
Okay.
Do you know if that would be possible to just come here without?
Yeah, I mean, if, you know, definitely.
Yeah, I can go see an orthopedist without my PCP approving it.
Yeah,
In fact, I don't even need to have a PCP with that plan. I can
right,
just-
right,
yeah.
right.
So I guess I should talk to them and find out whether or not I could just come here. and
Yeah,
do
you
it.
could, or you could just, you know, give us the information, and, you know, we always check on that anyway, when, you know, our front desk checks,
Yeah, so I can show you my card and then they can.
yeah, most, only the federal Medicare is the one that really needs that, you know, all the other insurances are okay.
Yeah, mine is through Aetna.
Okay, yeah, we see a lot of Aetna, so.
Are there some things that almost everybody should do?
Yes, I'll go over that,
Okay.
I'll go over that.
And another question,
Mhm.
about the recovering, right? Is the parents, how do I ask this question? Because I'm like 3 months busy and I don't, I mean, I see progress,
Mm-hmm.
but, how long is it gonna take before you can say that, hey, I feel good, I don't have to go anywhere, I can stop? Does it take weeks, months, or depends on
You
the
know,
condition?
Joyce, it's a hard question to answer without having evaluated you and, you know, knowing your condition. Like I said, the more chronic it is, the longer it is going to take to, you know, get you to a point where you can just continue on your own. But how long did you say you've been going?
About three months.
About 3 months?
Yeah,
Okay.
but maybe I had, excuse me, 2 weeks between vacation that I stopped going.
Mm-hmm.
So
So you stopped for 2 weeks
between the 3 months.
in between the 3
Right.
months, okay.
And last week I stopped last week too. I went on vacation too.
Mm.
So actually
Mm.
I was like, let me come here and make a decision and
Yeah.
see.
I mean, again, you know, you wanna see if 3 months is a fair amount of time where you should, you know, feel like you are better than where you were. You may not be where you wanna be, but, you should feel like, you know, you've made, you know, decent progress.
But is it something that you have to continue? Like I hear the gentleman was like for 10 years
Yeah,
ago.
I think that was,
It was me.
that was.
Yeah. So, I mean, that's what I'm so afraid for, that if I have to live with this condition forever, or
So
take
there is-
therapies forever.
Yes, there are exercises that you should continue until you've really reached 100%, you know. Even when you're in therapy, there should be exercises that you should be doing at home, which, you know, your therapist should give you. And again, you know, I haven't evaluated you, so it's hard for me to tell you which ones or, you know, so on, but, when with our patients, you know, we go over a plan of care, you know, we've given you instructions, and every time you come for your treatment, we are assessing, you know, where you are, how did you respond to your last session? How were things, if you came on Monday and you're back on Wednesday for your next appointment, how were things between Monday and Wednesday? You know, we always ask that question. We wanna find out everything that was good and everything that was not good, so that, you know, we can, make a determination on what your next session is going to be, you know, what we're gonna do at your next session. If you're ready to progress, we're gonna give you, you know, progressive exercises. If you're not ready to progress, we're gonna tell you that, no, you're not ready to do this yet. So, the whole rehab process is very important for a therapist to know. And we have found, you know, many patients come here after they've been to therapy been to other places for therapy, and come here and like, oh, you know, my therapist never did this, you know, or I had no idea that, you know, that this could happen, or, you know, this is what I should be doing, or, you know. So, you know, we're constantly educating you on the rehab process. When are you ready to, you know, do a certain exercise? Many places just have a cookie cutter approach, you know, they just have a list of exercises with pictures. It all looks great, you know, and they just hand it to you and like, here, do these exercises. Many times, you know, we find that you go to the doctor and the doctors just hand you, they have their receptionist handing people a list of exercises. Here, do these exercises, you know. I just had a patient, this morning, she came for her second visit over at our other location, and when she came for her evaluation, that's exactly what she said, that, my doctor gave me this list of exercises. And she was doing things and she was getting worse. And, I went over the exercises and I told her that, no, you're not ready to be doing these. This is a very advanced exercise, and if you do that now, you're going to worsen your problem, and that's exactly what was happening. And, she came in today for her second visit, and she was like, I'm just feeling so much better, with just one treatment. And, this is, we've had, the insurance company giving patients list of exercises. Here, just do these exercises and you'll be better. The rehab doesn't work that way, there's a whole rehab process that the approach we use is, based on your condition, what are you ready for, are you just still in the healing phase? Are you ready to go to advanced exercises? It's a step-by-step thing. And, it's best to follow that, yes.
Typically, how many times do you come, how frequently are the appointments for the plan?
Yeah, so
And how long do they take? How much time is consumed?
at each visit,
Yeah, during
Yeah.
a week or a month?
Mhm. So the average, again, is, like 3 times a week, okay? I always recommend that when you're starting, do the 3 times. It's like taking any medication, if you're taking, an antibiotic for an ear infection, or a sinus infection. It's best to, take, the maximum that's appropriate, so that, you get some headway. So I always recommend 3 times a week in the beginning, and then once you've, reached a certain point where, you're doing a lot of things on your own, then we start weaning off the therapy.
And is that about an hour each time?
I mean, it could be, in the beginning it may not be that much, but, as you advance with more exercises and you're doing more, more progressive exercises, you may be here longer than an hour.
Mhm.
So,
Okay.
it all depends on what stage of rehab you're at. And each time you come, we're gonna do what you need, not necessarily looking at, how much time you're here. Does that answer your question?
Yes,
Yeah,
thank
okay.
you.
Okay, so this is another question we get frequently asked is, can I not just do some stretches? Yes, of course, stretching is great, but if you're just stretching the wrong muscles, again, number one, you're not gonna make any progress. Number two, you could potentially, harm yourself, because you could be stretching muscles that are already overstretched. And even though they may feel good while you do it, it's not gonna help your condition. Same thing with going to the gym. If you like going to the gym, of course, that's great. Going to the gym is fine. But again, you don't wanna be lifting and, doing the wrong exercises, which could again potentially harm you. I'm a huge advocate of exercise. If you love to go to the gym, we absolutely advocate it. But, I like to make sure you're doing everything safely and effectively. And, once you're done with the therapy and you're, in a position to go back where you're educated enough to do the right things, we basically do help you get back to a gym program. So that, you're going to the gym and then you're going there, you're doing what we recommend, then you're coming back, we give us feedback, we make sure that everything's going well, and then you go back to your, so we make sure that you're going back, an educated, person, knowing what to do.
What about hobbies, like, is it John?
John?
John said he likes to fish, I like to fish too.
Yeah, absolutely. Mhm.
Fortunately, I cast with my right hand and my left shoulder is bothering, but I also like to kayak.
Absolutely,
You know,
so
that's
those are, mhm.
Doing this kind of stuff.
Yeah,
and,
so hobbies is another thing,
I
just
mean,
like the
I'd be
gym.
hurting myself by doing it.
Yeah, so, you know, if you're in therapy and, you know, we're looking at how you're doing it, you know, what you're doing. And then again, we would educate you, we would kind of, you know, retrain you to be able to go back and, you know, teach you what is the right, you know, approach to take when you go back to a hobby. So, again,
And
mhm.
swimming, Zumba, yoga is okay.
Same
I mean, the
thing.
yoga I have sometimes
Yeah,
no
it's the
problem
same
with.
thing, Joyce,
Or
you
the
know,
same
I mean,
thing.
unless I get my hands on you and I know what's going on, it's
Oh,
hard for me
okay.
to just say, oh, you know, yoga's okay or not okay. That's a very generic thing. And I don't feel comfortable telling a full audience with different conditions
Oh, okay.
that
Understand.
yoga's okay or not okay. It should be okay once you've done with therapy. You know, I mean, I can say that confidently, that any patient who has, you know, been treated by me, that I would give them, you know, the right time to go back to whatever, it's all factored into your treatment plan. You know, what are your goals to go back to? You know, if it's fishing, you know, or gardening, whatever it may be, you know, that we help you to get back to that in a step-by-step manner. So, thank you for coming.